transparency and accountability. Okay, so what is the thing that we should do for us to be able to establish accountability when it comes to AI use? And the fourth, and another important domain that could emerge when in terms of AI use is community engagement and trust. Okay, so the panels would also be covering, talking a lot more on how to engage community in terms of, designing AI for utilization. And the last, and also very, very important, is the human dimension, the human-centeredness. Okay, this is technology. Unless it puts humans at the center, it's not going to work. These are machines. They are there to serve us, not we to serve them. So, how do we make sure that we maintain human-centered decision-making while using AI? Okay? So basically, these are main and most important domains when it comes to ethical issues in utilizing AI. So having said that, that's to just give you a context, not to preempt the sessions. Each panelists are going to give us, covering almost most of the domains. They'll be giving us a talk for about 7 minutes, and 3 of them, once they cover the 7 minutes talk, and we'll be having, I turn to the audience, and for sure you would have reflections and questions for the panelists. You can also, for sure, would have ideas that you could complement. That's still okay. And we do that for about 20-25 minutes, and then finally we wrap up the session. So having said that, I'll invite the panelists to the podium. The first panelist that I'm going to call to the podium is Dr. Aweka Mskano. Dr. Aweka, please give him a round of applause while walking to the podium. Dr. Aweka is an associate professor at the Department of Health Metrics Science, at University of Washington, and a senior research advisor for the National Data Management and Analytics Center at EPHA. Dr. Aweka serves as a key leader for the Global Disease Burden Study at the Institute for Health Metrics and Evaluation. He is the country lead for a national and subnational burden of disease initiative in Ethiopia, and the lead representative for the African Burden of Disease Collaborative between IHFME and the African CDC. With over 2 decades of experience across clinical practice, academia, and research, he has published more than 110 peer-reviewed articles. He holds a master's in public health and a PhD from Addis Ababa University, and completed his postgraduate fellowship at IHME. It's wonderful to have you, Dr. Aweka, and I think I'm very excited to learn more from you. Round of applause, please. Our second speaker is Dr. Hailemariam Getachew. Please, Dr. Hailemariam, to the podium. A round of applause. Yes. Dr. Haile Mikhail is a PhD. He's a researcher at AHARI with extensive experience in health research and research ethics governance. He holds a bachelor's degree in nursing and a master's degree in international health with a specialization in tropical medicine and public health. His research focused around cardiovascular disease, non-communicable disease, and bioethics, and he has co-authored several peer-reviewed publications. Dr. Haile Mikhail serves as the vice chair for AHARI Alert Ethical Review Committee and coordinates a Pan-African Bioethics Initiative activities at AHARI. I think he has quite an extensive experience when it comes to ethics, for sure, AI as well. Thank you so much. It's wonderful to have you, Dr. Haile Mikhail. The third, we try to do a good job in terms of gender mix, and we have a female speaker among us. A third speaker, but not least, and I should have called you first, is La'alam Muliyallet. La'alam, please round of applause. La'alam Muliyallet. La'alam she's a public health professional. She's an educator. She's also a bioethics advocate with extensive experience in clinical trials, research ethics, and academic leadership. She holds a bachelor's degree in nursing and a master MAC in clinical trial, and has completed advanced training through Global Bioethics Training Program at Johns Hopkins Birmingham Institute. La'alam served as a lecturer at Talali University, and she has also worked at College of Health Science, Arabic Administration at Addis Ababa University, Currently, she's a program manager for Addis Ababa University John Hopkins Research Ethics Training Program at the School of Public Health. She also has a wide experience when it comes to ethics, and for sure, including AI. Again, a round of applause for the three speakers. Brilliant. And I'm hoping to see the four speakers. We'll keep praying to Dr. Sarawit will be joining us soon. I'm expecting for sure because he confirmed it, but once he showed up in this room, I'm going to introduce him. Otherwise, we're going to proceed with the three speakers, all right? Having said that, before I turn to the panelists to respond to the questions, they'll be covering the 5 domains that I've mentioned earlier. First question goes to Dr. Mikhail. You know, we talked about a lot. I think everybody knows quite a lot about AI use should not have any bias. You know, we should ensure equity, and there has to be an algorithm fairness. You know, and everything about data, privacy, protection, transparency, and capital. Given that, everybody knows that. But the issue is, you know, how do we make sure that this will never happen? You know, that AI would not gonna cause any inequity or doesn't cause any unfairness when it comes to algorithm. Okay, what system should be in place, and what should users be mindful about, or in general, how do you ensure ethical standards and practices when it comes to AI utilization? You have 7 minutes.
Thank you, Dr. Salamor, for the kind introduction and for the opportunity. I think we all agree that AI is changing the landscape of healthcare, public health, and it has tremendous potential to accelerate interventions effectiveness. But at the same time, we have to be mindful of the ethical challenges it may also be associated with. One of these could be related to bias, algorithm fairness, or and equity. It primarily comes from how we train the data, how we train the AI, based on which type of data we train. Because whatever we train, it is going to replicate that. And if we use a biased data, which is not representative of the community which we want to serve, then it is going to be devastating. It may amplify even historic unjust inequalities. Therefore, anything when we try to use AI in our setting, we have to make sure that on what the type of data are trained of. As we know, most of the AI interventions currently we're using are trained elsewhere. So before we just employ or deploy in our system, we need to be sure that this is not biased to our context. So as long as possible, we have to encourage the use of local data, which this year's conference is meant to promote. So based on the current data, as you know, Ethiopia is very diverse. Even a single data set may not suffice. That means it has to come from diverse data sources, which mimics the population we are going to serve. So the first one is diversity of the data sources as a solution for mitigating the potentials of bias. The other thing, we need to have an audit mechanism. Once we have the tools, we have to test these tools against different population subgroups, depending on the socio-demographics or geographic variations. And we have to be sure that they didn't discriminate those who are vulnerable, those who we want to serve more. Public health, as you know, tries to address the social determinants of health. And who have access to these tools? and who don't. So this has to be also carefully examined in the mitigation strategies. This has to continue not only in the test phase, even after post-employment, like we do in pharmacovigilance in case of, for example, drug. This also has to be tested after deployment. We need, beyond technical performance, we need to see how these tools are making impact in the real world, like what social impact did these tools achieve. So we have to have the system to monitor the long-term impact of these tools, and at the end to reach out the goal we want to achieve, that is equity. Universal health care is the overarching theme of this, so we need to make sure that even a good tools, mindful of the diversity of the population, has to be accessible to those who need it. It has to be available to all geographic setups, not only into urban setting, but also to the rural villages, and also it has to be somehow acceptable to the society. When we use it, it should not be like an alien thing. The community has to know it and has to approve or accept the tool we are going to use. Generally, these are the points I would like to mention.
Thank you so much. I think same question, Dr. Awaka. How do we ensure ethical standards and practices in AI use? But you could focus on privacy and data protection, and also talk about how we ensure transparency and accountability.
Thank you so much first for the kind introduction. I will try to draw my experiences from EPHA, the National Data Management and Analytics Center, and also my experience from the global data system on the data and health metrics from the global burden of disease. So probably we could have different types of AI. We could have AI models that our data scientists, analysts can develop. And also we could have, generative AI that, freely or openly accessible, and based on our request, probably we could have more private AI system when it comes to the generative AI. So it depends on the type of AI, it's a lot. So maybe with our National Data Management and Analytics Center at EPHI, we could have like district level vaccine coverage for that matter, and maybe regional level subnational burden of disease estimates, or malaria forecasting, whatever. So in this case, as already mentioned by Dr. Haile Mikhail, if we don't have data from Afar, Somalia, or Gambela, and we have data only from Addis Ababa, so then the AI model will use Addis Ababa data, and it will forecast for or predict for Afar or Gambela. So what does that mean in terms of policy, in terms of strategy? Okay, so for example, the malnutrition risk factor or the tuberculosis prevalence in Addis could be very low. But if the data is informing the AI model for Afar, and if we could have the same result, comparable to Addis Ababa, so what does that mean? And then, with this kind of model outputs for the regions, especially with the regions that have data scarce regions, probably would come up with a wrong conclusion, wrong evidence. So I think we should be very responsible for using AI. Of course, we are very optimistic to use AI, but we should be at the same time very cautious how to use AI. So as already mentioned by our moderator, Dr. Solomon, this is ethics and human dimension of AI. What does ethics mean? Is this something as simple as, ticking or, making the checklist, or is it a kind of system that we are talking about? Data privacy, data protection, what does that mean? How do we maintain the privacy of, the patient's data? How do we protect, our data system? And then how much we are transparent. This is a very big challenge for us. Transparency of our data system, documentation, and also taking responsibility, accountability. So when it comes to privacy, what the National Data Management and Analytics Center, Data Repository and Governance Division is doing, we are having multiple data from different research institutes, universities, non-governmental partners, surveys, statistics. So de-anonymizing the data, de-identifying the data is the first step. So cleaning the data. Then it could be for our internal consumption, and in some cases we will be requested to share that data for users. So having that de-anonymization, de-identification is our responsibility, to share the data so that, the data scientist will not trace back the patient or, the study participant. And in some cases, we will also work with partners. It could be, national or local partner. It could be international partner. So purpose limiting is also another, ethical standard. So we agree, with this data to achieve these project objectives. But, if the partner wants us to use that data out of our agreement, they have to ask again and get permission. Otherwise, data needs collaboration, partnership, all these things. So purpose limiting is another. Especially with the technology and data, we have the research experience that, we ask consent from the study participants or patients. That is, getting the legal permission. But is that sufficient? That's not sufficient. So the study participants or the community has to understand, has to have a clear understanding why we need this data and what is the output we are expecting from using AI, digitization, whatever. It could be DHIs to data, HMIs from the Ministry of Health. It could be, research institute data from EPHA, from AHARI, from other private research institutes as well. So this informed consent is very important. Both ways. One, to get the legal permission, at the same time, to have, the mind of, full understanding the impact of, having that data and AI to improve our health. And the other important point probably we should very discuss is that the cyber security. There could be many threats that can hack our data system, and I'm not sure how much we have this kind of, security system within the universities, in the Ministry of Health, in the EPHA, So this end-to-end encrypted and secured servers, we always in the National Data Management talk about this, and of course infrastructure is not easy, it's very expensive, but we have these secured servers as much as possible. So these are the 4 issues that we should take care of, or establish a system, to have a privacy and more protected data, and maybe for the transparency and for the accountability perspective. What if, okay, we go to ChatGPT or Gemini, and then we ask it that, okay, what are the top priorities of Ethiopia? And then we got that data, evidence. Okay, we decided that, okay, the national procurement of drug or whatever is, these are the top priorities, and let's purchase this from somewhere abroad. What if that is wrong? Who is accountable for that? Is that the AI vendor? Or is that the decision maker? So that is accountability. And then we have to document, we have to be transparent that, okay, we have this evidence from this and our decision is based on that. If that is the case, then we can trace back, and then we can say that, okay, this is something to revert or to repurpose, to redirect, whatever. And the transparency issue, in terms of, data, this is a big challenge, to be frank, with our National Data Management and Analytics Center. There could be researchers who have shared, data for us, but, usually we have difficulties to understand your data. It's not labeled, we don't have codes, we don't have, full documentation of the data. If we don't have that full documentation of data, how the data scientist can understand that? And at the same time, with the modeling and AI tools, if I'm responsible to do the analysis, I have to clearly, mention that, this is the AI tool that I applied, and then check the performance of the AI tool, and come up with this level of sensitivity, validity, whatever. And then with this process, I have selected this. And these are, the details of the data processing, the data management, and finally the results. And maybe I can mention one of the example from Institute for Health Metrics and Evaluation. Some years back, there was a big challenge with WHO and other UN systems, and also with Institute for Health Metrics and Evaluation. We produce disease burden results for hundreds of diseases. WHO estimates some other difference, results, and we are also producing some other results, and, always debating on that. So finally they come up with, this guideline for accurate, transparent health estimate reporting. So we have to report, the detailed programs, the models used, the data inputs, and the final results. In that case, we can see where the discrepancy is. So probably we need to have this kind of frameworks, guidelines for AI, to make sure that, okay, we use this data input and data process with this AI tool, we have this prevalence of TB. And Professor X, if he has also the same, things or different data sources, that could, reconcile the methodology and the AI tools that we are using. So transparency, accountability, privacy, and data protection, these are very critical when we are using AI, and to be optimist in using AI. Thank you.
Thank you so much, Dr. Awaka. I think you brought up a very, very important point. Before turning to Lala, maybe quickly, who is accountable then, for example, for misleading, if I use an AI and then I got misguided and I arrive at a wrong decision, and who am I going to hold accountable in that regard? Because you've touched upon the accountability, and I was thinking of, who to make accountable in this regard.
Probably it may start from you, because, we need to have a clear understanding and the purpose of using AI. For example, a decision maker may not have time, so then clicks on AI and then got some information. So probably the decision maker may need more extra time, to understand and, to triangulate that information. But when it comes to the system, for example, the National Data Management and Analytics Center, we have a protocol. So I will tell you finally the challenges of this protocol. But in this protocol, everyone is, including the institution, is responsible. The data repository and governance experts, the data analytic modeling experts, and also the lead researchers, the directors of the center, and also the DJ of the institute. So we all are equally responsible, when it comes to the outputs of the AI. But, for the different data sources, probably we have to make accountable of the data systems, and that needs, national governance framework. For the routine data, who is accountable? Is that the health center, health post, regional health bureau, or who? The Ministry of Health? For the surveys or for the EPHA generated results, who is responsible? So that needs a general framework, but we all are responsible. Thank you.
Thank you so much. Let me turn to Lalam. Lalam, we're evolving on the same team, but I just want you to dwell more on the human dimension, talking more about how do we maintain a human-centered decision-making and AI use. And also you can touch upon other domains as well.
Thank you, Dr. Salamon, for generous introduction. And I'm very humbled and honored to be here today with you, all of you. I'm here, Dr. Adamu just delegated me. I'm very happy to be here. I think Dr. Awaka and Dr. Haile has already mentioned about the transparency, equity, and accountability. I just want to add two things. Like before modeling the AI, we should have system safeguards and responsible users. Like as Dr. Haile and Dr. Awaka mentioned, that we need to work on our local data. If we have a good quality data, our model, when we train the AI, the output will be good. So we need to work on our data, and also our data should be a representative. Like representative is very important. We can use the AI that was trained in another place. For example, if our AI model trained with a tertiary hospital, and if we want to apply that to the primary health care, the output might not be good. So we have to like balance our data, and we have to have a fairly representative data set for our data, so that we can have a good model of AI. And the other is, like for the responsible users should start asking questions. Like as a researcher, clinicians, and every stakeholders who is going to use that AI model should start asking questions. How this model is trained, what population are used to train this model, so that we will not make any mistakes while we are applying these AI models. And the others is when we use AI, we should think that the algorithm, we should question about the algorithm, which data they are using, and also the researchers, the clinicians should collaborate to train that model, so that one of the recommendation always mentioned from different expertise, like we have to collaborate with different expertise, like clinicians, stakeholders like public health, data science experts. They need to come up together and work on the model. One thing I learned in the past is like we should treat the AI model as a protocol. Like when we develop a protocol, we always consider those three ethical principles. Like the first one is respect for the person, beneficence, and justice. So when we train our model, like we should make sure that these three ethical principles are integrated. So when the human oversight the AI will enhance or augment the decision, not replace the decision of the human. I think in the morning session, this has been discussed well. I think Bru and Professor, they were mentioning that, Professor Binan was mentioning that the human oversight is important. I believe that AI will not replace us, but until the people who's using AI effectively will not be replaced by the AI, but a person who's not using effectively the AI, that person might be replaced. Maybe he might be, even Shimelis in the morning mentioning that he stopped hiring people who doesn't know about AI. So human oversight still is important. The innovation, like when we develop the model AI, we should think about the mitigation. If the risk happen, what's the mitigation for that risk? Like we should anticipate the risks, like if the model is representative, who is missing, what are the measurements, like how the variables are defined in the model. We should know about the algorithm, how the model is developed. And the other is human-centeredness. Like AI should prioritize the human welfare and beneficence. So we should prioritize the social benefit than the model. So everyone is responsible for the AI outputs. So there must be ethical frameworks in place. Developing the ethical framework is not an option now. It's an essential part of the process. So we should work on our ethics capacity building. Even for us, like in the IRB, when this digital related protocols, when the digital protocol submitted, we find it very hard to assign peoples because we don't have, in the health sector, we don't have those expertise. Like most of them are clinicians, biostatisticians, pediatricians, so it's always good to have incorporated other expertise in the ethical review process. And also we should have a feedback loop that the user can give comment so that we can always update the model because it's not always a stable one. The model should be revised and updated with the available documents and information. Yeah, thank you.
Thank you so much, Lala. I think for sure you're going to come back again once I hear from the participants. Just to, I don't know if I have to kind of summarize it quickly so that people would think their questions or will have something to reflect on. One thing that strikes me the most is like being myself as an IRB member. This is also an area that I need to keep myself updated on. Okay, so people who are on a research and a review boards, ethical review boards, you need to also do a personal development plan in learning about AI because that's obvious, it's going to come. So you should get ready for that. It's an insight that I got. One, I think what summarizes everything is for us to have an ethical standards and practices. We need to have a framework and ethical documents that are written to ensure ethical standards. Yes, that's also another important point that has been mentioned. There is so much that I could have said. Responsible users is also, now we're going to give it back to also the users. It's not only for those who develop the model, it's also users are also responsible for that. So what we need to do also what is called critical appraisal in this regard, right? And while using AI, one of the things that we should do is we should do appraisal. Like we're not going to use every AI model that shows up. So users need to be responsible to do an appraisal before even they use it. Okay, what the data sources are, how the machine is trained, and stuff like that. And I'm also happy that one of the areas that we can ensure equity is through representation, especially that's the need to have a local data as well. As long as we don't have our own data, at the end of the day, what the model will come up with is something, data which is entirely alien to us. That's what we're going to use in the future. So developing quality data in-house and homegrown is also an important area that we need to focus on. So, having said that, I'm not going to summarize everything that's said here. There is so much raised. Maybe if none of you would reflect on it or raise any questions, I'm going to bring it up again as a summary. So, back to you. And for sure people must have a lot of questions. It was heated in the morning. It's going to be heated in the afternoon as well. All right? Yes, Mule? Yes. Anybody?
Thank you very much. I really thank and appreciate all the presenters for giving us a highlight of how ethical, how human dimensions of AI are considered in research and data use. The very first reason that we, sorry, I'm not audible, I know, but the very first reason that we, okay. The very first reason that we set this as a talking point is that in recent years, a lot of research is coming to EPHA and other research advisory boards that are dependent on the use of AI And as you know, we usually do not have the practice and the experience. So we would like to this to be highlighted more and assess for capacity building in handling and managing research protocols that engage AI. In this regard, maybe Lalam is working on this at the Addis Ababa University IRERC. So what's the plan? I know that this question would also come to me because EPHA should also be engaged in capacity building, but we first need to, as Dr. Solomon said, we first need to have trained ourselves in designing, AI-related, AI utilizing research. So what should we do? How do we, make capacity of researchers and users that involve AI in Ethiopia? What's your reflection in this one?
Okay, thank you. I thank all panelists. Okay, my name is Molla Mekashau from Addis Ababa University, GeoHealth Research Hub. So I thank panelists. You raised an important and critical issue of AI, ethical AI issue. Actually, it is a burning agenda globally, and it is a challenging really. My question relating with this is, really, can we make AI as we inspire ethical enough? Because even organizations who just request with terms to give confirmation for our privacy, really is that they are keeping our privacy. Most of our informations we got in AI in back. Really, is that possible? To make ethical AI in reality as we wish. Still, it is a challenging for the future. And relating with this, there are some groups that say that deep learning but shallow evidence. Deep learning, shallow evidence. In this perspective, I think still it will continue with a challenge. So from your just experience and from your point of view, can AI will be improved in the future or deteriorate much? This is, I think, a dilemma in most of us. So good to have your comments on these 2 points. Thank you.
Thank you so much for the opportunity, and I'm also very happy to be part of this very important session. One of the panelists said very clearly that system safeguard is very important, and yes, we all agree system safeguard should be proactively and cautiously implemented here and there, particularly at all points where the data are going to be generated, particularly research, health system data, and the like. So, but I would like to hear or to be discussed on how much the guidelines, the targeted guidelines are in place at different points. For example, universities, at research institutes, and health institutions, and everything here and there, particularly where the health data, health system data are going to be generated. The other one is, for me, one of the main objectives of using AI is to simplify, to give the boring activities to AIs, the repetitive things to AIs, and to give the space for the human being so that the human being can be more creative, to think more, and giving the boring things, the repetitive things to AIs. But how is the reality on ground? How should we use it? Than being more dependent on AI. I guess we should think proactively and creatively so that AI can assist us. Thank you so much. Thank you. I'm Bikila Ragasa, a PhD student from Jimma University.
ጥሩነህ መባል የዲጂታል አንጻራዊ መሃይም ነኝ እና የምጠይቀውም ዛሬ ከተባለው ወይም ትንሽ ወጣ ሊል ይችላል ግን በስራ ላይ በሚውል ሁኔታ ላይ ያለኝን ችግር ለመግለጽ ነው። አሁን በሽተኛውም ጉግል አድርጎ አስተማሪውም ወይም ተማሪውም ዲፕሲክ አድርጎ እኛ ደግሞ ለኢንተርቴይንመንት የምንገባ ወደ ዲጂታል ወርልድ ዩቲዩቦችን ምኖችን አይተን ብዙ ነገር ያወቅን ይመስለናል። አዋቂዎችንም ቻሌንጅ ለማድረግ የምንቃጣበት እድል ይኖራል እና ይሄ ነገር አሁን ዳታ ፕሮቴክሽን ፕራይቬሲ ምን የሚባል ነገር አለ። እነ ጉግል እና እነ ዲፕሲክ እና ሌሎቹ ኢትዮጵያን በሚመለከት ከኢትዮጵያ ነው የሚገዙት ወይስ ፈጥረው ነው የሚሸጡት? እና ከነሱ የሚመጣውን መረጃ ማስረጃ ጭምር እንዴት ነው ሙያተኞች አንድል የምታረጉት? በማስተማርም ደረጃ ይሁን በሽተኛ በመንከባከብም ደረጃ ይሁን ራሳችን ከምን እንጠብቅ? ምንስ ክፍት ሆነን እንቀበል? እግዚአብሔር ይስጥልኝ። ስሜ ጥሩነህ ስንሻው የቀድሞ የመንግስትና የዩኒሴፍ ሰራተኛ አሁን ጥሩተኛ ነኝ።
እግዚአብሔር ይስጥልን። አይ ቲንክ ጥሩ ጥያቄዎች ተነስተዋል። ለፓናሊስቶች እኔ ሞዴሬተር ሞዴሬተር ጥቅሙ አይመልስም። በአቅም ምንም ችግር የለበትም። ሀሳብ አይገባው መልሶ ለሰዎቹ መስጠት ነው። ስለዚህ ኳሱ ተወርሯል፣ መልሼ ወረውረዋል። ማን ነው የሚቀበለው? በቀኝ በግራ who like to research?
Thank you. I think these are interesting questions. The discussion ያመቻሉ ብዬ አስባለሁና I think some of them I will try to address. One of the thing was Professor Alamayo, he mentioned, was about awareness generally. Are we how much aware of the AI tools and who should be responsible to aware the community? So awareness, one of probably the first guideline in AI ethics was UNESCO guideline in responsible use of AI. There are 10 points in the guideline. One of it was awareness. So generally, before we commit to AI, we need to be aware generally. And how we will be aware, there are a number of online resources. At the same time, EPHA is probably an ideal also to initiate such type of awareness mechanism to its members and to other professionals as well. So awareness in the guideline is clearly mentioned. So we need to be aware in general sense, and we probably are the ideal people to take the lead. Regarding the privacy issue, Dr. Awaka, he mentioned a lot of things, but I think we need to also integrate one of the thing from the 3 fundamental principles. Autonomy has to be also integrated. Patients or any other community member has to be aware when they provide their data to the health system. Probably they give it for the purpose of seeking care, but it can be used for secondary or tertiary level other uses. In that case, they have to be clearly aware. If we don't do that, we are not doing currently, but if we don't do that, then public trust on the health system will start to deteriorate, and they may refrain from seeking vital cares. This happens actually in recent, I don't know, a couple of weeks ago, there was a publication BMJ, the case of Kenya-US data deal, what a colleague here mentioned as well. So how was this data transfer? There has to be at least community engagement. People has to be aware, and there has to be this transfer of data has to be oversighted by independent ethics committee or other bodies, rather than just institute to institute dealing. So in privacy issue, beyond the inscription and policies, how to collect data, who have access to the data, where it should be stored and the like, then the ethical component, which is informed consent, has to be there. So people have to know for what purpose their data is going to be used, if it is going to be used and transferred. The other very interesting question, deep learning but shallow evidence. Will AI to improve or deteriorate? I think it's a very good question. One of the things, the challenge AI has is AI works in black boxes. We don't really know how the decisions or the outcomes are reached. We don't know. And interestingly, when we use more and more data, the precision increases, but the black box matter gets even more complicated. But our intention to be ethical, to the AI to be ethical, the model has to be explainable, which is the simplest form. It is in a contradictory. We need to use a lot of data to make it more precise, but we cannot explain that. That is also a challenge. But we have to note also, AI is, its precision or its predictive value is for the context, for the time being, because you may prompt the same prompt we may use today, and after a week or after a month, if you use the same prompt, the result you find is going to be different, because it starts to collect other data as well. So it is shifting always, but we need to have some safety margins which can tolerate. I think the other very interesting question raised was, AI was meant for decision support, especially in clinical support, in clinical care. They are there for decision support system, which means we can task AI for administrative tasks, so that our clinicians, our public health professionals could have more time to deal with the patient. So the human element is here. We cannot replace healthcare by AI or robot. There is fundamentally the empathy, the sympathy of human being to the patient, to the community. To do so, we have to probably shift some of the administrative tasks to AI, so that we can free up some time for our professionals to deal with the real patient and the real human issues inside. I think these are the things probably with the responsibility. I think, again, I will repeat the last one. AI are not there to replace human beings. Human oversight has to be always there. And if AI end up in, wrong decisions and we use it, then that will be the responsibility will lie on the institute which deploy the tool, the developer which develops the tool, and also the final user without checking, relying on it. There is a tendency, even though we say the repetitive tasks to the AI and the real decision has to be with a human being, but with time, people start to trust the AI output more and more. So they may negligently comply with the decision, but this is absolutely wrong. We have to be careful with that. Yeah.
Thank you so much. I think we need to know when to use it. No, adella. Prezali falgalai. Ya itakalilo al buzun nagar. Alcharasabachu madella. Charsobsha.
Okay, thank you. I just want to reflect on Professor Alamayo's questions. Like in our Arabic, that was a tough question actually, because our Arabic composed of very senior people, and it's very hard for them to send them online trainings and admit there. And the best way what we have been discussed recently was to engage juniors people as a member in the Arabic, so that those we can give trainings for those juniors people because they have time and they are very interested to explore more. So we want to have them as an alternative member initially, then day by day, then we will see their performance and we will make them a permanent member. And the other thing, we are still working on giving webinars and other organizing workshops, but due to the budget, we didn't host any AI-related workshop yet. But it's good to collaborate together with other associations and Arabics, and let's organize together and host one AI-related trainings. So that would be very helpful. And the other is I think Bikil asked about the health data system. We should integrate the international ethical frameworks with our institution ethical frameworks, because when we always tell to our students not to use any ChatGPT or not AI related things, but we should set a framework to what extent that they can use that AI. And also there must be institutional policy that anyone can refer and be in the same plane that everyone can understand in the same way. The other thing that has been raised in the morning, about data sovereignty, when a researcher submitted a protocol, they always mention that the data stored somewhere else in the funder places, or maybe the collaborator partner institute. We asked them to store that in Ethiopia, in their, maybe at the university server or other server, but they always mentioned about the budget, and also they tend to mention that it's not safe to store here. So even the qualitative data that we collected, such as interviews, it's stored in their server. So since we didn't have a capacity, we can't enforce the researcher to store the data here. So we need to work on our own capacity. Earlier in the morning, they were mentioning that there are different public sectors that they are selling servers with a good amount of money. So we should, as all ethics committee should review to what extent that server is secured and confidential. So we need to work on that. Thank you so much.
Thank you so much, Lala.
Yeah, thank you so much. ምናልባት የመጨረሻው ጥያቄ እነ ጎግል እና ሌሎች የኛን ዳታ ከየት አግኝተውት ነው ወይስ ደግሞ ከሌላ ሀገር ባለ ዳታ ነው ሞዴል እያደረጉ ለኛ ይሄንን የመሰለ በየአይነቱ የመሰለ ኤቪደንስ ሼር የሚያደርጉን የሚለው ነገር ትንሽ እንትን ብሎኝ ነውና ምናልባት አንዱ ጥያቄ ላለፈው 40 50 ዓመት 60 ዓመት ምን ዳታ ሰብስበናል የት ነው ያስቀመጥነው ከማን ጋር ነው የሰበሰብነው ዳታውንስ አሁን እናገኘዋለን ወይ የት ነው ያለው የሚለው ትልቅ ጥያቄ ነው ምክንያቱም የኢትዮጵያን ዳታ እዚህ ሆኜ ከማቀው በውጭ ዓለም ባለኝ ኔትወርክ እናንተ የተሻለ ላውቀው ይያለው ስለዚህ አሁን የሰበሰብናቸው በሴንትራል ስታቲስቲክስ የተሰበሰበ ሊሆን ይችላል በኢፒኤችአይም ሚኒስትር ኦፍ ሄልዝ ፎር ዘ ላስት 50-60 years የሰበሰበው ያሰበሰበው ከነማን ጋር ፓርትነር አድርጎ ነው ዩኒቨርሲቲዎች አካባቢ የተሰበሰበው ዴታ ምናልባት ኢንተርናሊ እኛ ለኛ ሸር ለመደራረግ እንቸገር ይሆናል ለውጭ ሰዎች ግን በጣም ምንሰጥ ይመስለኛል ስለዚህ ዳታችን አገር ውስጥ ነው ለማለት ተቸገራለሁ ዳታችን ያለው ውጭ ነው አንደኛ በፐብሊኬሽን ፐብሊሽ ስለምናደርግ ዳታችን እዛ ነው ያለው ሁለተኛ በፓርትነርስ አማካኝነት ምክንያቱም ብዙ ጊዜ ዳታ ሲሰበሰብ ዳታው አይወጣም የዳታው ባለቤት እኛ ነን ኢትዮጵያ ናት ምናምን የሚል ክሊር ነገር ብዙ አላየውም ምናልባት አይአርቢ ውስጥ ያላችሁ ልታግዙኝ ትችላላችሁ ስለዚህ ሰው ሲወጣ እንደውም በኪሱ ዳታ ይዞ የሚወጣ ነው የሚመስለው ስለዚህ ዳታችን አገር ውስጥ በደም ፕሮቴክትድ ሆኖ ጠብቀ ነው ተንከባክበ ነው ያም ደግሞ ኳሊቲ ዴታ ሆኖ ዝም ብሎ እንዳው አይነት ነገር አይደለም መሆን ያለበት ኳሊቲ ዴታ ሰብስበን ስለዛ ምን እንነጋገር ከሆነ it makes sense እነሱ እንደውም ያችን ቀነጣጥበው ምናምን እንደ ቆራሊዮ ጠፍጥፈው ነው የሆነች ነገር አድርገውልን በኤአይ የምናገኘው ማለት ነውና አይ ቲንክ ራሳችንን መጠየቅ አለብን ላለፉት 40 50 60 ዓመታት የሰበሰብነው ዳታ የት ነው ያለው ወመዘክር የምናገኘው መጽሐፍ ነው የተጻፈ መጽሐፍ እንጂ ሮ ዴታ አይደለም የፐብሊክ ሄልዝ ዴታ ሮ ዴታ የት ነው የምናገኘው ዩኒቨርሲቲ ነው የምናገኘው የት ነው የምናገኘው ስለዚህ ይሄ በጣም ሁላችንም ልንነጋገርበት የሚገባ በይበልጥ ደግሞ ኤአይ እንግዲህ ላለፉት 4 ዓመታት በጣም ነው አድቫንስ ያደረገውና አም ኦፕቲሚስት ካሚንግ 10 years ጨራውንም አንደርስበትም ስለዚህ ቢያንስ ከዳታችን ተጠቃሚ እንድንሆን ካፓሲቲያችንንም ቢውልድ እንድናደርግበት ምናልባትም ደግሞ ሞኔታይዜሽን የሚባልም እኮ አለ ዳታ መሸጥ የሚባልም እኮ አለ እንዴት ወሰነው የጤና ካንትናችንን ኢንሹራንሳችንን ከቨር የሚያደርግልን ቢሆን ወደፊትስ ስለዚህ እሱ ላይ በደንብ አድርገን ተጠያይቀን ዳታችንን ሀብታችንን በደንብ መያዝ እዛ ላይ መነጋገር ወደፊት ትልቅ እንደ ነዳጅ ይቆጠራል ይባላል እዛ ላይም አንድ ነገር ነው ግን ደግሞ ከዛ ባለፈ ከዳታችን ህዝባችን ተጠቅሟል ወይ የሚለው አንድ እንትን ነው ሁላችንም ቋጥረን ነው በየእንትናችን ያስቀመጥነው እንጂ እንዳው አሁን ሚኒስትር ኦፍ ሄልዝ ሲፈልግ ዳታና ሲፈልግ ኤቪደንስ ከስንቱ ነው ተለምኖ የሚገኘው በቃ የልመና አይነት ነገር ነው ያለው ስለዚህ አይ ቲንክ ይሄ አይመጥንም አሁን ዘመኑ በአይ ዘመን እንደዛ አይነት ካልቸር አይመጥንም ስለዚህ we have to be very open we have to be very smart we have to be very proactive የሚቀጥለው 5-10 ዓመት ኤአይ የት ሊደርስ ይችላል ብለን ማቀድ በቻል አለብን ገና የሚያሰለጥነን ሰው መጠበቅ የለብንም ካፓሲቲ ቢልዲንግ ማንንም የሚያደርገን ምናምን አሁን ኦንላይን ነው ካፓሲቲ ቢልዲንግ ስለዚህ ኢንስቲትዩሽናል እንትኖች ሊኖሩን ይገባል በቃ እዚህ ኢንስቲትዩት ውስጥ ኤአይ ትሬኒንግ it's a must to do መባል መቻል አለበት ኢቲካል ኤሊጂቢሊቲ ነው ወይ ኤአይ ልክ ነው ኢቲካል ኤሊጂብል ነው ምክንያቱም ብዙ ነገሮች አሉ ስለዚህ ኢቲካል ኤሊጂብል ሊሆን ይችላል ግን እንዴት አድርገን ነው ያንን ኢቲካል ኤሊጂብል የምናደርገው የተሻለ አንደርስታንዲንግ የሚኖረን መቼ ነው ምናልባት ኤአይ ሞዴሊንግ ትሬኒንግ ዛሬ የሚሰጠኝ ሰው እሱ የተማረው ከ3 ዓመት በፊት ይሆናል አሁን ኤአይ ሌላ ቦታ ደርሷል ስለዚህ እኔ ከሆርስ ማውዝ ነው የሚባለው አይደለ ከዛ ግንቼ ነው እንጂ ያኛውን ትሬኒንግ መውሰድ ለኔ ኮስቲ ላይ ያሆን ይችላል ስለዚህ በጣም አድቫንስድ በጣም ቫይብራንት ዳይናሚክ ስለሆነ ዴታ አድርገን ነው ራሳችን ኮፕ የምናደርገው የሚለው ነው ይሄ ትንሽ ከኢቲክስ አንፃር ልናየው እንችላለን ከካፓሲቲ ቢልዲንግ አንፃር ምናልባት ፕሪሰርቪስ አካባቢ ዩኒቨርሲቲ አካባቢ ያለው ስንትን እንዴት ነው ልጆቻችንን ዲስከሬጅ እያደረግናቸው ነው ወይስ ደግሞ ይቻላል ትችላላችሁ በሉ እንደዚህ በሉ እያላቸው ነው ምንድነው ያለው እንትን እሱንም በደንብ ማየት መቻል አለብን ምክንያቱም የዛሬ 5 ዓመት ዛሬ ያለው ነገር አይኖርም ስለዚህ በየአመቱ አፕዴት የሚደረግ በሚኒስትር ኦፍ ሄልዝም ሊሆን ይችላል በኢፒኤችአይም ሊሆን ይችላል ዩኒቨርሲቲዎች አካባቢ ፕሮቶኮል ድራፍት ፕሮቶኮልም ሊሆን ይችላል ይሄንን ሪፈረንስ አላደረክም ይሄ ነገር አልተገኘም ይያልን በጣም ፔሲሚስት የሆነ እንትን ካለብን ቴክኖሎጂ ላይ ምንድነው ተማሪያችን ላይ ምንጭነው ነገር ስለዚህ በጣም ችግርም እንዳንፈጥር ጥንቃቄ ያስፈልጋል በጣም ደግሞ ወደ ኋላም እንዳንቀር ጥንቃቄ ያስፈልገናል ማለት ነው ምክንያቱም የዛሬ 5 ዓመት ዛሬ ላይ ሆነን ብንገኝ አፎርድ አይደረግም እንደ ሀገር እንደ ፐብሊክ ሄልዝ እንደ ሄልዝ ሴክተር አፎርድ ማድረግ አንችልም ስለዚህ በተገቢው መንገድ ሊድም ለማድረግ ወደፊት ያለውን መጪውንም ነገር ታሳቢ አድርገን ለመስራት አይ ቲንክ ፕሮአክቲቭ መሆን ዳይናሚክ መሆን እንደገናም ደግሞ ኢቲካልም መሆን የዳታ ሀብታችንንም በደንብ መያዝ አስፈላጊ ይሆናል። ኢን ፕሪንሲፕል ኤአይ we are leading ኤአይ ነው ኢን ፕሪንሲፕል ያለው ነገር ግን አንዳንድ ቦታ ላይ በትክክል ኤአይ ሊድ እያደረግነው ነው ወይስ ኤአይ ሊድ እያደረገን ነው? እሱኑ we have to make sure ኤአይ ሊድ እያደረገን ከሆነ ምናልባት ማሱ በበዛ ቁጥር ኤአይ ሊድ ያደርገናል ዜን ያልን እንቀጥላለን ማለት ነው። ያ ደግሞ ራሱን የቻለ ብዙ አይነት የኮሎናይዜሽን እና የብዙ አይነት ነገሮች ሊመጡ ይችላሉ። ስለዚህ ኤአይን ሊድ እናደርገዋለን ስንል እንዴት ነው ሊድ የምናደርገው? በምን አይነት ፍሬምወርክ ነው ሊድ የምናደርገው? ምን አይነት የሰው ኃይል ፕሮዲዩስ አድርገን ነው ሊድ የምናደርገው የሚለውንም አይ ቲንክ እሱን በደንብ ማየት ሊኖርብን ይችላል ብዬ አስባለሁ። ስለዚህ ይሄ ፓናል እኔ ታይምሊ ነው የምለውም ታንክስ ቱ ኢፒኤችአይ በጣም ይሄንን መነጋገር የዛሬ ዓመት በሌላ ርዕስ ነው መነጋገር መቻል ያለብን እንጂ አዌርነስ ላይ መሆን መቻል የለበትም ብዬ አስባለሁ። ታንክ ዩ
ሶ ማች አወቅ አይ ቲንክ በደንብ ሰመራይዝ የሚያደርግ ነገር ያነሳ ይመስለኛል። በመጨረሻ ፍቅራብ አንድ ሁለት ሰው ድል ሰጥና ጨርሳል።
በአማርኛ ልናገር። አይ ቲንክ ትላንትና ከትላንት ጀምሮ ኤአይ ላይ ብዙ ተወያይተናል። ብዙ ነገሮችን አትሊስት አይናችን መክፈት ችለናል። ብዙ አወቀን ማለት አልችልም፣ ግን አይ ዋንት ቱ ፕሮፖዝ ኮል ቱ አክሽን። ኢፒኤችኤ የኤአይ ወርኪንግ ግሩፕ ቢያቋቁም ዴን ዩኒትም ሊሆን ይችላል ስሩ ታይም። ግን አይ ቲንክ አሁን እንደምሰማውም እንደምናየውም ቴክኖሎጂ በጣም እየቀደመን ነው። ለአሶሲዬሽናችንም ለሜምበሮቻችንም መሆን የሚችል ቴክኒካል ወርኪንግ ግሩፕ ወር ወርኪንግ ግሩፕ ተቋቁመው ይህንን ነገር አጀንዳውን ወደፊት ቢያራምድልን የሚል ጥሪ ቢተላለፍ ደስ ይለኛል። ታንክ ዩ።
በጣም አመሰግናለሁኝ። በጣም ጠቃሚ የሆነ ውይይት ነበር። ምትኬ ይባላለሁኝ ከአዲስ አበባ ዩኒቨርሲቲ ነኝ። እኔ መናገር የምፈልገው ኢትስ አባውት ኤአይ ዩዝ የሚለው አሁን ዶክተር አወቀ ያለው ነገር ነው። ኤአይ ዘ ቴክኖሎጂ አይደለም። መጀመሪያ ጊዜ እኛ በእጃችን ስንደምር ነበር አይደል? ፈተና ስንፈተን ኦፕን ቡክ ነበር። ስታቲስቲክ ፎርሙላ ማጥናት ነበረብን። then we got the calculator, then we have Wikipedia, then Google, now we are at the AI አይደል? so ማለት this is an assistant ተማሪዎቻችን ይሄንን መጠቀም አለባቸው ነው የምለው። ግን እንዴት ይጠቀሙ የሚለው ነገር ላይ በጣም አሁን ጭራሽ ኤአይ ተጠቅመህ ከሆነ ዲክሌር አርግ የሚሉ አንዳንድ ጆርናሎችም እንደዚህም ኤአይ ዩዝ ምን ያህል ነው ተጠቅመሃል የሚል ዲክሌር እንድናረግ የሚጠይቁ አሉ። yes ዲክሌር ማድረግ ጥሩ ነው፣ ግን ተማሪዎቹ ማፈርና መፍራት የለባቸውም። this is an assistant ግን እንዴት መጠቀም እንዳለባቸው ማየት ያስፈልጋል። ሁለተኛ በጣም ብዙ ጊዜ ኢትዮጵያ ስለ ዴታ እናወራለን፣ ዴታችንን በጣም እንወዳለን። do we really have a real good data? እሱ ላይ ነው ማየት ያለብን። ሼር የሚደረግ ነው ወይ? እና ዴታ ሼሪንግ is a fashion አይደለም። ዴታ ሃጊንግ is outdated። ግን ሼር የምናረገው ዴታ ዲአይደንቲፋይ መደረግ አለበት። ፐርሰናል አይደንቲፋየርስ፣ ሎኬሽንስ ምን የመሰሉት በሙሉ ተጠንቅቀን ሼር ማድረግ አለብን። ግን ብዙ ጆርናሎች ዴታውን አምጡ ይላሉ። አሁን ቀደም እንዳለችው ዓለም ኳሊቴቲቭ ዴታ ሳይቀር አምጡ ይባላል። ግን እኛ we have big data repositories። አዲስ አበባ ዩኒቨርሲቲ በራሱ ሪፖዚቶሪ ያለው ኦልሬዲ ክሬት አድርገናል። ኢፒኤችአይ ላይ ሪፖዚቶሪ ማስቀመጥ እንችላለን። ዜን ዴታችሁ የት ነው ሲባል ሊንኩ ብቻ ነው የሚሰጥ። ኢንተርናሽናል ኦርጋናይዜሽን wants to know if we really have that data። አንዳንድ ጊዜ ጆርናሎች ዴታው አለ ወይ ኩክድ አይደለም ወይ የሚለውን so we need the connection። እና ዝም ብለን ጆርናል በጠየቀን ጊዜ ለምሳሌ በጣም ብዙ ጆርናሎች ዴታውን ይላው ዴታ መላክ የለብንም። እንደ ፐብሊክ ሄልት ፕሮፌሽናልስ እዚህ እንዳለ እንደ መምህርም ማወቅ ያለብን we have data repositories ናሽናል so ናሽናል ሪፖዚቶሪ ላይ ዳታችን ማስቀመጥ አለብን ላለው። አመሰግናለሁ።
በጣም አመሰግናለሁ። አይ ቲንክ እንጨርሰው። ለፕሮፌሰር አለማየሁ ፕሮሚስ አድርጌለት ነበር። I'd like to be very brief። መጀመሪያው በፓናል ታሪክ ከሰዓት በፊት በተወሰነ ደቂቃ ያለቀ ተብሎ ታሪክ እንዲመዘግበው ለማድረግ ቀድመን እንጨርሳለን። ራውንድ ኦፍ አፕላስ አይ ቲንክ ኢሴንሻል የምንላቸውን ነጥቦች እንደጣፈጠ እንዲያልቅም ስለፈለኩ ነው። ፎር ሹር ኮንቨርሴሽኑን መቀጠል ይቻላል። ዩ ካን ኔትወርክ ዲሪንግ ኮፊ ብሬክ ኤንድ ዲነር አይ ቲንክ ዩ ሃቭ ኦል ዶዝ ቻንስ። በጣም ጥሩ ነጥቦች ተነስተዋል። ኮል ፎር አክሽን ኦልሬዲ ተነስተዋል። ዴታ እያልን ነው። መጨረሻ ኤአይ ስንል የራሳችን ዴታ ነው ኤአይ መልሶ የሚሰጠን። ስለዚህ በምን ያህል ኳሊቲ ነው ይሄም ራሱን የቻለ የምናወራበት ነው። በነገራችን ላይ ኤጁኬሽን ኤአይ ኢን ኤጁኬሽን ኢማ ኮንፈረንስ ኢትዮጵያ ሜዲካል አሶሲዬሽን ማርች 27 ይጀምራል። አንዱ ዘንድሮ ኤአይ ነው በየቦታውና ኤአይ ኢን ኤጁኬሽን እና ሜዲካል ኤጁኬሽን ነው። ስለዚህ አይ ቲንክ ፕሮፌሰር ምትኬ ያነሳሽው በደንብ ኤጁኬሽን ላይ እኔ ሴም ቶፒክ ሞዴሬት ማድረገውና በደንብ በኤጁኬሽን ዙሪያ እንዴት እንጠቀምበት እንዴት ኤቲካል ዩዝ ኢን ኤጁኬሽን መምጣት አለበት የሚል ውይይት ይኖረናል። አንዱ የምናወራው አሁን ተማሪዎች እንደ ድሮ ሊትሬቸር ሪቪው ቁጭ ብለው መስራት አለባቸው ወይ should they do something more important ክሪቲካል ጥያቄ መጠየቅ መልመድ አለባቸው ወይስ እንደ ድሮ ሊትሬቸር ሰርቹ የምንፈልገው ነገር ነው? ዲቤቴብል ግን these are an honest conversation that we should have። ስለዚህ ኢን ኤጁኬሽን የምናወራው ነው ዛሬ ፎርቹኔትሊ ወይም ይሄ ሴሽን ፎከስ እንዲያደርግ የተፈለገው ኢቲክስ ነው። አይ ቲንክ ኢቲክስ እንል ዓለም በተወሰነ ነካክተዋለች። በተለይ ከሂውመን ዳይሜንሽኑ ጋር ተያይዞ ኢቲካል ዩዝ ስናወራ የኢቲክስን ዶሜኖች ሪስፔክት፣ ቤኔፊሰንስ፣ ማልፌሰንስ፣ ጀስቲስን ባማከለ በተለይ ሞዴሊንጉ ዲዛይኑ በዛ መልክ መሆን እንዳለበት ኢቨን ዲዛይን የሚያደርጉት ሰዎች ማሰብ እንዳለባቸው ሰምተናል። አይ ቲንክ ቴክአዌዎቹን እናወራና እንጨርሳለን። ክሪቲካል መጀመሪያ አሁን ያልኩት ነው። ዲዛይን ላይ ቅድም ያልናቸውን ኢቲካል ከዩዝ ብቻ ሳይሆን ኢቲካል ዲዛይን ኢቲክስ ዲዛይኑም ላይ ይፈልጋል፣ ኢቲክስ ዩዝም ላይ ይፈልጋል። ኦኬ ሞዴሊንጉም የሚሰሩት የሚጠቀሙትም ኢቲክሱን ይፈልጋሉ። ከዛ በኋላ along the way end to end ኢቲክስን ማሰብ ያስፈልጋል when it comes to AI use። እሱን ያዙልኝ። ሁለተኛ አይ ቲንክ ዴታ አቬል ማድረግ ነው መጨረሻ ሶሉሽን። እኛ ምን ያህል ዴታ አቬል አድርገናል የሚለው ነው። የሰጠነው ነው የሚሰጠን ስለተባለ በተቻለ መጠን የዘንድሮም ቲም ሃርነሲንግ ያለው ለዩኒቨርሳል ሄልዝ ከቨሬጃችን ጥሩ እንዲሆን በየሄድንበት ጥሩ ዴታ መሰብሰብ አሁን በጣም ከምንም ጊዜ የሚያስፈልግበት ጊዜ ላይ የደረስን ይመስለኛል። ለምን መጨረሻ ላይ AI የምንጠቀም ከሆነ ጉዳችን ሊፈላ ነው ማለት ነው። ዴታ ከሌለን አይሆንም። ስለዚህ ያንን መስራት እንዳለብን ነው። በነገራችን ላይ ዴታ ስንል አሁን እኛ የምናለው የሰርቪስ ስታቲስቲክሱ ምኑ ብቻ አይደለም የሚያስፈራን። አሁን we're going to genomics። አሁን ፋርማሲካሎቹ they're out there looking for data. What kind of data are we talking about? We're talking about gene mapping, sequencing ላይ ነው። ስለዚህ አሁን ዴታም እኮ ስናወራ ኢቲክስ ምንለው የሚቀጥለው እሱ ነው። ዴታ ሼሪንጋችን ምን ይምሰል? ኦኬ ወደ ጄኖሚክስ እየተሄደ ነው። እንደው ሰርቪስ ታክሲስ ብቻ እንዳልሆነ እንድናቅ እሱን ያዙልኝ። ኢኳሊ ኢምፖርታንት has to be monitored። በየጊዜው እያየነው ውጤቱን እያየነው እየገመገምነው የምንሄደው ነገር መሆን አለበት። መስራቱን የምናውቀው የዛኔ ነው። ቢቂላ እሱን ያዙልኝ። ሜቢ ሶስተኛው ፖይንት ሃይላይት ማድረግ የምፈልገው የቱ ጋር ነው? እዚህ ላይ ሄዶ ሁሉንም ነገር የሚያስረው ኢቲክስ ሲባል በህግ የታሰረ መሆን አለበት። ፍሬምወርኮች በየጊዜው እንደሚያስፈልጉ ኤአይ ላይም አሁኑን ኦልሬዲ ጀነሬት ማድረግ መጻፍ መጀመሪያ ያስፈልገናል። ሌትስ ኪፕ ኮንቲኒየስሊ ለርኒንግ። አናቁም። ይሄን ኮንቨርሴሽን እንቀጥል ይመስለኛል የዛሬው መልእክት። ይሄን ካልኩ የሰማነውን በልቦናችን ያሳድርልን። አመሰግናለሁ። መልካም ጊዜ። የከፈተው ነው የሚዘጋው። ፕሮፌሰር አፈወርቅ የለም።
እንዳመሰግን ተወክያለሁና እጅግ በጣም እናመሰግናለን። ሞዴሬተሩን ዶክተር ሰለሞንን በደንብ ተዘጋጅቶበት ከመጀመሪያው መግቢያውን ኮንቴክስቱን ሴታፑን አሳይቶ ውይይቱ በጣም እንዲያመር ግራውንዱን በጥሩ አድርገህ ፍሬም ስላደረከው እና በደንብ ስለመራልን በጣም እናመሰግናለን። ሞቅ ያለ ጭብጨባ ለዶክተር ሰለሞን። ፓነሊስቶቻችን በጣም እጅግ በጣም ኮርተንባቸዋል። የጠበቅነውን ከጠበቅነውም በላይ ሰጥታችሁናልና እጅግ በጣም እናመሰግናችኋለን። ወደ ቦታቸው ሸኙልን። ከምስጋና ጋር ፎቶግራፍ እዚች ጋር ተነሱ። ሁላችሁም እነሱ ፎቶግራፍ እየተነሱ in the meantime እሺ ከዚህ በኋላ ሻይ ወደ ቲ ብሬክ እንሄዳለን። ሁላችንም ተመልሰን ወደዚህ ነው የምንመጣው። ሁለት ሴሽኖች አሉ፣ አጫጭር ናቸው። አንዴ ጤና ጥበቃና አንዴ አምሬፍ ቤስት ፕራክቲስ ሼሪንግ እስቲ ምንድነው ደግሞ ኦን ዘ ፊልድ ያለው ቤስት ፕራክቲስ እሱን ደግሞ እንስማው ተመለሰን መተን ለአንድ ሰዓት ያህል እሱን ከሰማን በኋላ ወደ ማጠቃለያው እንሄዳለን ማለት ነው ከሻይ ረፍት በኋላ እዚህ ተመልሰን እንገናኛለን ስልክ የጠፋበት ሰው አለ ይባላል እሱን እንግዲህ እዚህ አካባቢ ነው ስልክ የጠፋበት ሰው ካለ ማልበል እኮ ያገኘ ሰው ካለ ማምን ብለው ይስጡሽ ምሳዬ ስልክ ያገኛችሁ የምሳዬ ነው ምሳዬ ብላችሁ ስጡ
የኛ ማህበር ህዝባችንን ማስተባበር ሀገራችን በእኛ ማበር ትሆናለች ያለም ጀንበር ይቀጥላል የኛ ማህበር ህዝባችንን ማስተባበር ሀገራችን በእኛ ማበር ትሆናለች የጤና ጀንበር የኛ ማህበር የኛ ማህበር የኢትዮጵያ ጤና አጠባበቅ ማህበር የኛ ማህበር የኛ ማህበር የኢትዮጵያ ጤና አጠባበቅ ማህበር ከመነሻ